a couple of weeks. I was out of town last week and I missed my tech person, so I cannot do it without him. So you might hear him reading some questions. If you're joining on YouTube, make sure you hit subscribe. Help us grow our YouTube channel. We've got lots of great things coming up, so hit subscribe. And if you're coming to us on TikTok, again, you know that I am usually going live on Tune In Tuesdays. Let me know where you're watching from. I was on a big family vacation last week. My parents, my sister, my niece, my 3 kids. So it was a big thing in Puerto Rico. My mother is born and raised in Puerto Rico, and I am 50% Puerto Rican, so I got to practice my Spanish. One funny thing about this is, if anybody knows what Puerto Rican food is, for the whole week, I ate plantains, yuca, pork, a little bit, which I don't usually eat, beef. You can't go in and order a side of broccoli in Puerto Rican restaurants. It's rice, beans, all these carbs. And so I just went with it. Plus the low temperature was 80 degrees. So it was really, really not a good running weather. So if you're used to running in 20 degrees and then your body goes to 79 degrees, it's really hard to run. So I exercised far, far less, ate nothing but carbs, and we're talking about carbs and fried food. And I think it's something about the resistant starches of the yuca and the plantains that for some way I didn't end up coming back with any weight gain. Maybe it's that, maybe it was the lack of work and the more sleep and the less stress and the happiness of being with my family. But anyway, I'm here today to answer your burning questions about hormones. I've had a really busy month. I was speaking at a Forum Lecture Women's Conference in San Antonio. The next week, or the week before, I was in Toronto. I'm headed next month back to West Palm to speak again, and then to Mexico City. So it's been like boom, 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 boom. Plus I've had my online lectures, usually Tuesdays, for a precision medicine fellowship. So I am here to answer your questions. I'm a physician. I'm a traditionally trained OB-GYN who's also boarded in integrated and functional medicine. So I can answer your questions, but I'm not your doctor, so I can't give you specific medical advice. But if there is something I can help you with, if there is somewhere I can point you to the right direction, I would love to just lay the questions on me. For those of you that are on YouTube and for those of you that are on TikTok, let me know, what are your questions? There was a huge Oprah special, which I did not watch last night, on menopause. So we know that there's a lot of more information about menopause. I still feel like I'm seeing some content about scaring women about the risk of hormone therapy. I just saw a big content creator, somebody reposted that he was saying, you know, you really shouldn't take hormone therapy. You can balance it with your diet. You can take some supplements. And if you really need to, only take a little bit of hormone therapy for a small amount of time, which, you know, does not apply to everyone. There's many, many people who can't balance their diet to feel better. There's many people who can't take a supplement to make them feel better. So I want everyone to understand the options for hormone therapy. So start listing your questions. You know, there is a little bit of a delay from the questions, so post your question. I'll get to the questions in the answer in the order that they're listed and answer your question.
A few questions here on YouTube.
Oh, we got a few questions on YouTube.
Yeah, so Nuzhat Syed. Hi, can you advise how to treat menopausal high blood pressure? They're watching from London.
Oh, hello from London. Great to hear you. It's kind of late for you right now. I'm glad you tuned in. Well, high blood pressure is a funny one because the blood pressure can go up after menopause, and it can be a symptom of low estrogen. Progesterone in its natural state helps your blood pressure. And if you actually look at the textbook, estrogen lowers your blood pressure. Oral estrogen can increase your blood pressure. So the first thing I would do is check hormone levels. And if you can't do that in London, I know the NHS has a lot of restrictions. A low-dose transdermal estradiol patch and a micronized progesterone could help that. And just monitor the blood pressure. So that's one of the things that I would do.
ASR wants to know, hi, what do you think of T2?
T2, I don't have a lot of data on T2. I don't know if it's an active form of thyroid. It is an intracellular option that is converted from reverse T3 by one of the deiodonases inside the cell. And I don't know if we know that I don't know if it's inert or if it actually agonizes the receptor in the nucleus to have any action. So I'm not really sure that I'm totally up on that.
Nancy Yolima says, hello, Dr. Scott. How can I know if it's time to up my E and P dosage? I have been on HRT while in late peri, but since I am full menopausal, my hair is falling out and joint pain is back.
Nancy, those are two signs of low estrogen. And I know that all doctors don't always check levels, but it is about 90 days, so about 8 to 12 weeks till you can assess a dosage. So if you've been that long on this dose, it may be time to increase your dose. It's not always hot flashes that is the low estrogen symptom. The joint aches and the hair loss is definitely a symptom of low estrogen. Okay, Shasta says, I'm 36, my estrogen is super low, and my progesterone is low too. No energy, just blah, blah. Shasta, my first question would be, are you having normal cycles? When in your cycle was this monitored? We'd want to know if the connection between the brain and the ovary are working. That would be hypothalamic. There are certain things that could suppress that, mold and yeast. Also, wondering if everything else is normal, like your cortisol and your thyroid. So I would be looking for a secondary cause, or really a primary cause, thinking that that could be the secondary issue. But Shasta, it definitely seems like you need to get the rest of that checked. They're all related. Okay, Veronica Ortiz, what if you can't take HRT? Well, that's a great question. When we say HRT, the risks are not the same for estrogen, progesterone, DHEA, testosterone. So it's very rare that someone can take none. The biggest thing is if you're actively getting treatment for breast cancer. But I do have breast cancer survivors. When given the risks and benefits, they understand that not only a quality of life, but they have a higher chance of dying of a heart attack without hormone therapy than they do of having a recurrence of breast cancer. But that is an individual thing. So if you can't take HRT, again, there's very few instances that I have seen of my patients that might just mean that you can't take estrogen. So we would look at the rest of the hormones and work with you. Okay, so now you're saying, Veronica, that it made you have more anxiety. That makes me think it's more a function of the dose than that you can't take it. Shasta, thyroid cycles are normal. Okay, it's interesting. So I'm wondering where in your cycle your levels were low and your thyroid is great. Did they do a full thyroid panel or did they just check a TSH? So thinking that maybe cortisol is an issue. Dara said, how long for hormones to reset after miscarriage? Oh, I'm so sorry about your loss. My first cycle was normal. But now I'm ovulating on day 9, having 15-day cycles, or tests you'd recommend, really struggling. So after a miscarriage, and of course this depends how far along you were, it usually is around 3-ish months, sometimes longer, depending on your own body until you get back to normalcy. So your first cycle is sometimes not an ovulatory cycle, but kind of a sloughing bleed from the miscarriage. And then you ovulate after that. So it sounds like if you ovulated on day 9, your brain was really trying to increase the signal to get the egg to release. And then you had 2 overlapping cycles, which can happen. So I would definitely want to see what happens the next time, or I would look at a cycle day 3 FSH and estradiol, and maybe even a day 21 set of labs. Sandra XO, can't lose weight in perimenopause. What do I need to adjust? Well, there's a couple things. Women in perimenopause are very carb sensitive, so we usually talk to them about eating pairing and eating timing, meaning we really want you to have 12 hours overnight with no food and space your meals by 4 hours, keeping in mind that you want to pair a protein and a carb. I try to limit 20 grams of carbohydrates per meal and try to make sure you're having at least a total of 80 grams of protein per day, depending on your situation. So those are a couple things you can do. The other thing that women in perimenopause start to do more of is high intensity training, and they really neglect their weight training. So doing less high intensity training, and which drives up your cortisol, and more weight can really help you do that.
Follow-up from Nuzhat says, what's the maximum amount of estrogen? I have been on patches for more than a year, and the progesterone tablets make me feel dizzy, and high blood pressure medication does not seem to be working. My BP was 160/98 today.
So the progesterone is always taken at night. So that dizziness usually wears off. If it doesn't, a lot of my patients, I put them on a slow release that's compounded. The patches go all the way up to a 0.1 patch. So 0.025, 0.0375, 0.05, 0.06, 0.075, and 0.1. So it does sound like maybe you're not on the right dosage or the dosage form for you. I know there's not a lot of compounded alternatives in the UK. So you want to make sure definitely you're taking that progesterone at night. HV-Jax, have you tried Femring with your patients? I haven't tried that with my patients. I have some patients that are on the E string, but not the Femring. That is an option. It's non-oral, but I don't have a lot of patients that want to take estrogen that way. Okay, let's see. Dazed and confused. So birth control can cut ovarian risk, which nobody told me since it killed my mom and my aunts. Yes, absolutely. Oral contraceptives decrease your risk of ovarian cancer and uterine cancer. And then depending on the patients, it could increase your risk of cervical cancer and breast cancer depending on how long you take it. But definitely is something that decreases the risk of ovarian cancer. So if you had your aunt and your mother, I definitely would want to make sure that you're being tested for any kind of genetic, like a BRCA gene or some kind of ovarian cancer genetic SNP. It's me, Taylor, TSH 0.63, free T4 1.4, and free T3 is 6. So that free T6, it depends on your labs, but our normal lab is 2 to 4.2, so that free T3 of 6 sounds really high. I'm not sure if it's a total T3, but if it's a free T3, that's pretty high, and it seems that's why your TSH is suppressed. Christine Lynch, what is the best way to take testosterone? Great question, Christine. So if you haven't noticed, recently the FDA did remove one of the warnings on testosterone, mostly aimed at testosterone replacement for men, but it applies to men and women, where they were putting a cardiovascular risk on the label. And so they removed that black box warning after there was a trial called the Travers trial where they did not see an increased risk of cardiovascular things. Because of some of the older studies, we have been taught not to give it orally. Now, I just recently attended a lecture, which I'm forgetting who he was, from Baylor. He was a male testosterone replacement specialist, and he was saying there are some new things that are oral testosterone for men that don't cause the same issues as methyl testosterone. Now, having said that, we don't give it orally to women. We give it either transdermally, which means the topical cream. We give it as an injection. Some people choose to get a pellets, which is a surgical implanted thing. And also, we've started giving it as a sublingual lozenge. Shasta said you had a full panel thyroid. I don't remember what day in my cycle. So that makes a huge difference, Shasta, and that is why you have to know what time in your cycle. So if it was low, maybe you had them tested on your period. Progesterone is always going to be low then, and estrogen could be too. So I definitely want to recheck you at the appropriate time of your cycle. Okay, what do you recommend for perimenopausal symptoms which are persistent? Who do I see? So that's a really great question. So you could start with your OB-GYN or your family practice doctor, your PCP, but you want to ask them, do you have any additional training in hormone therapy or in menopausal symptoms? Do you feel like is this something that you can treat? Because most of us, and I know I trained over 30 years ago, we got no training in hormone therapy as an OB-GYN. So you want to ask them what kind of training they've had. If not, if neither of them seem very up on it, hopefully they'll be honest with you. You can look at menopause.org, which is the Menopause Society's website. Those practitioners have extra training. They're going to be traditional. They're going to know the literature. They're not going to be scared of giving you hormone therapy, but they're not going to check your levels more than likely. They probably won't. You can also look at www.4m.org, and that is a fellowship. Look for someone who's fellowship trained and board certified in functional integrative medicine.
2 questions from YouTube. One is from Newer. Is there natural replacement for estrogen?
So the estrogen that we use that is bioidentical is chemically, structurally the same as what we have, and it's synthesized from a Mexican yam source in a lab. So when diabetics get insulin, that's natural. They're no longer getting beef and pork insulin, but we're not drawing insulin from somebody, a human, and giving it to a diabetic. Somebody in the lab is making insulin that is human recombinant insulin that is bioidentical. Same with thyroid, bioidentical. So we don't get estrogen naturally in the environment. It comes from a plant source and is synthesized in a lab to be chemically, structurally the same as we have in our body. That is bioidentical estradiol.
Giuliano asks, hey, Dr. Tara, do you think birth control is bad for female health overall?
I would not agree with that statement. I know that's a loaded question, especially in what the society is having now with some of the new laws. There are people that need to prevent pregnancy. So I would never say that it's bad. I took birth control pills for 10 years. They really helped my endometriosis pain. They really helped a lot of the symptoms that I was having. I was having heavy, painful periods. When I was done with my family, I got a Mirena, and after I had a Mirena a couple times, then I got my tubes tied. So it depends on the question that you're asking. For reversible contraception, for people who need to prevent pregnancy, oral contraceptives are a great option. I often will use a progestin-only SLIND so that they're not getting the estrogen if there's somebody who I'm worried about giving them more estrogen. And I do like giving the IUDs because it's only a progestin. It's not supposed to be systemic, although now we know that it does get systemic. And I'm a fan of permanent contraception when you're done with your family and you no longer want to. Vasectomy is my favorite form, and tubal ligation. So overall, I would not vilify birth control pills. My problem with oral contraceptives is when they're used for a medical therapy that is not to prevent pregnancy. Good question. Going back to Christine's question, how much of the testosterone? We know that a healthy ovary produces 1/3 of a milligram a day. So we'll start anywhere from a quarter to a half a day, depending on how we're going to give it. If we're going to give you an injection, we may give you 20 milligrams every 2 weeks to start and titrate up from there. I know with pellets, the doses are much, much higher. Okay, show enough. Good to see you back here. Post got a hysteroscopy and I continue to shed light blood. I'm on BHRT cream and gel. So after you have a surgical procedure like hysteroscopy, it is not uncommon to have some bleeding after that. If it does happen going on and on and on, you want to make sure that you don't have an infection in the uterus. That's endometritis, and that can cause kind of lingering spotting. You got a question on YouTube?
Yes. ASR asks, any advice for mildly raised testosterone and presumed PCOS age 24?
Okay, for someone who's 24 that has irregular cycles, that is not ovulating, and high testosterone, either in a serum evaluation or a physical sense of acne or hair growth here or hair loss, that is the diagnosis of PCOS. One of the things that can really help is inositol, 1 gram twice a day. A lot of times we will also use Chaseberry or Vitex, but you got to look at the metabolic piece to see if someone is insulin resistant. So that would involve a fasting insulin, a fasting glucose, and an A1C, or an oral glucose tolerance test. So once you treat that abnormality, the testosterone does seem to come down. Okay, lifelong learner, what do you think of peptides for weight loss, GLP-1? So we're using them in our practice and we have had great response to them. We've had a few people that can't tolerate them, one person that had like a gallbladder issue, one person that had a pancreatitis, one person that had a history of bowel issues that had some issues. But so far it's been a positive thing. We are doing personalized micronized dosing with our patients. Jellyfish, wouldn't they have to detox from the estrogen? Jellyfish, I'm missing like where your question is in referring to. So everybody does need a detox from estrogen, and that happens in our liver. Dazed and confused, high BP not being managed, have... I missed your question. Hold on, I got to go back now. I'm a little behind on the questions, guys. Let's see. Okay, high BP not being managed by, they have cardiac workup by chance. Well, you always want to make sure that if you have uncontrolled high blood pressure, you're looking for other sources.
Megan asks, you may have covered this and I apologize for asking, what can I do if progesterone makes me extremely depressed? I've only done micro oral and it puts me in a very dark place.
Yeah, please do not take it. That doesn't happen very often. And my own thought is that you have a SNP that you turn GABA into glutamate. So usually progesterone agonizes the GABA receptor, but that can turn into glutamate, which is excitatory. And I have seen a very small amount of people have that reaction. Some of my patients do better with a controlled release option or a topical option in a cream in another form or a vaginal option. So that may be a better fit for you. Let's see. T. Kokia, what's your option on HRT in a gel? So we have something called Divi Gel, which now comes in generic. That's my favorite because it's a small dose with a shorter half-life. There is Estrogel that does have a longer half-life and a higher dose, and a lot of people don't need to take that daily.
Switz says, I'm sweating every night. Should I look into cortisol or estrogen levels as a possible cause? My day was in normal range and I'm on progestin for endometriosis. FSH was in normal range.
So FSH isn't a proper evaluation of your ovarian hormones. We need to see what the estradiol and progesterone are. Now, if you're taking a progestin, that can suppress ovulation depending on what you're taking, and that can be a source of lower estrogen and night sweats. But you're right, all of those things can be contributed to. So when we evaluate patients, we check all of it. Kimberly Fry says, if someone has emergent hysterectomy but ovaries remain, how would this affect their progesterone levels as they approach 40 years old? So I'm wondering if that was an obstetric reason. That's one of the reasons, or bleeding. So I hope you're okay, Kimberly. But I will tell you that with a hysterectomy, even if ovaries remain, because there's some of the blood supply that is cut off, anecdotally, we might anticipate that you could have an earlier menopause. So you might have lower progesterone levels, and it'd be a little bit harder for you to tell. Do you have a question? Okay. Mrs. Mo, thanks for joining. Switched from birth control to HRT 3 weeks ago. Do I still have to worry about post-pill acne? Interesting. So acne decreases your, birth control decreases your acne by increasing a binding protein that binds up testosterone. So depending on your estrogen testosterone ratio, I'm not really knowing what your levels are. I'm guessing, Mrs. Mo, that now you're menopausal. So it really has to do with what your androgen levels are. So hard to say. Alicia pulling, any advice for PMDD? So the things that have helped as far as the data, calcium, for some reason, calcium has helped, magnesium has helped, evening primrose oil. Those are things that have been studied. Now remember, haven't been a lot of things that have been studied. So I would say some of our patients do well with B-complex vitamin. Some of them also get some relief from 5-HTP, and it kind of depends, or L-theanine can be something. Dazed. Okay, BRCA1 positive has killed 3 generations. Oh, I'm so sorry, and I'm glad that you found that out. And the recommendation is for you to take oral contraceptives to decrease your risk. So it sounds like you're on top of that. Emerald, what labs should I run for chronic fatigue? Wow, Emerald, fatigue is a huge thing. I would definitely want to look at your iron, a full iron panel. I would look at a full thyroid panel. I would look at a full hormone panel. If you're still having cycles, I would look at that day 19, 20, or 21 of your cycle. I would look at your adrenal hormones. I'd want to do an AM cortisol in the blood to start. I'd want to do a DHEA, a DHEAS, and a pregnenolone. So that's where I would start. There are probably a lot of other things I'm not talking about, like infections that could cause chronic fatigue, mold, heavy metals, those things. Triple yellow hearts, my primary offered new medication approved by FDA, class of antidepressants, and I declined. So there are some medications that are non-hormonal approved for hot flashes. One of them is Veoza, that is approved. It's non-hormonal, works through the neurokinin and bradykinin receptors in your brain. And then also Paxil, which is an antidepressant. We call it behind the scenes Paxil Paxamon, because people gain weight. So those are the 2 that are indicated for hot flashes. The other thing that could possibly help if that's your issue is there are some rhubarb supplements. One of them is called Estrovera. News 8 Chris, help, my labs came back abnormal with 11-deoxycortisol. Okay, so I'm wondering, was that a serum level? Was that a urine level?
Mm-hmm.
And that is an adrenal hormone. And I don't know, News 8 Chris, how old you are. That would be one of the screening for congenital adrenal hyperplasia, which you could have maybe be late onset. So wondering where you had that, but good luck and keep us posted, News 8 Chris. Dr. Joanne, thank you for sharing the live. Okay. Let's see. Thank you guys for giving this a follow. Make sure if you're following me here, head on over to subscribe to my YouTube channel as well and sign up while you're at it. Look in the link for our free newsletter that comes out every Tuesday. It's me, Taylor, and is it any way for me to get my free T3 down until I see my endocrinologist? Well, that's a great question. Normally we need to know the source. We need to know what your antibodies are. Is it Graves' disease? What the treatment is for hyperthyroidism is aimed at the symptoms. So one of them is like a beta blocker to get your heart rate down, depending on what it is. The other ones are methimazole or PTU, which block the thyroid hormone receptors. I don't know of any natural therapy off the top of my head. It's me, Taylor, so I hope you're feeling okay. User 503789, do I know a Shreya Parikh, MD? I do not think I know her. It sounds like she's got an Indian name, and I'm also half Indian, but I don't know that I know her. Renee Scott says, where are you located? My practice is in northeastern Ohio, close to Akron, and I'm licensed in the state of Akron. Oh, Ohio. And so Ohio has a rule that for us to see patients, we have to physically see them in Ohio face-to-face for the first visit. And then after that, for the calendar year, 1 year after that, we can do virtual visits. Okay, I am trying to catch up on these questions before my battery dies. Is there natural ways to keep Graves' disease in remission? So Hope, Marion, so we always look in the functional world at the gut with Graves' disease, and we're also going to look at cortisol to see if we can find out that's an autoimmune issue, so we're always looking at the gut for that. Kate Power, spotting and cramping between periods normal. Kate, it is common, but not normal. Normally in a normal menstrual cycle, you shouldn't have spotting in before. Makes me think you've got a problem with your estrogen. Renee Scott, progesterone makes me loopy. Progesterone makes me loopy. Cream, really? That's so unusual. You must be very sensitive to the dose. I'm thinking that maybe you need a lower dose. I do have a few people that are very sensitive to doses like that. Are you taking new patients in California? I am not licensed in California, but I knew Dr. Suzanne Gilbert-Lentz is someone who sees a menopausal patient. Amanda Haynes, total hysterectomy 45 on estradiol patch. Some say I need progesterone too. Can't sleep, movie. Those are two great things that progesterone does. I personally always give progesterone with estrogen, regardless of whether you've had your uterus removed or not. So I highly recommend progesterone for you to take at night because it would help with those two things. Can I do a telehealth appointment with you if I live in Florida? Amazing, Edel. I do have a license that's going to expire in Florida, so I am not taking any new patients in Florida, but we do have a Forum Health in Tampa that you can see one of my colleagues, Dr. Saxena.
Chantel Soul asks, is there natural progesterone?
So there is a bioidentical progesterone that is synthesized in a lab from Mexican yam, and it comes in oral form. Compounding pharmacists can make it in either a sublingual form, and also they can make it in a topical cream. There's also gel forms of natural